That's the qualitative. Now the quantitative. Remember I told you I took 4 of the key questionnaires that were used more often in the studies. Now remember, I had 13 studies, and you're saying 2 studies use this one? Yes, but the 2 studies that use this one came across with the same messages as a lot of other studies with multiple questionnaires with the same results. Okay? So that's why I think this questionnaire might be the most useful to get the same information when you've got 9 other questionnaires getting at the same thing, but none of them the same. The SF36 was used across 6 of the 13 studies. There was another quality of life study or questionnaire that was used, but this one seemed to get at that distressed and non-distressed more. And I could go through all these things with you. I'm going to go across these things again in the discussion, so I'm just going to leave them for that if that's okay. And then the other 2 that I had was the GLTEQ physical activity questionnaire, which seemed to really help understand the activity portion, and the Charleston Comorbidity Index, which tells us what kinds of problems are we having as we move through, and it still goes to the quality of life issue as a result. The conclusions came down to 4 of those 5 theme categories, with which the quantitative studies, actually the results of those fold into this. So what you're going to see now is everything combined into the discussion, which is the results of both areas put together. So here we go. Existential issues. Let's talk about depressive coping versus active coping first. That came across every study that we looked at of the 13. Depressive coping, depressive mood, helpless, hopeless disposition, and higher emotional stress. What does that tell me at this point? If you're negative, if you look at things as what it did to you instead of what it did for you, you're in trouble. Active coping, hopeful living, positive feelings, calmness. Always go into it with, I know what's going to happen, I know I'm going to come out ahead, and I know things are going to be okay. Emotional distress and smoking. If you quit smoking, your quality of life gets better. That one article, though, was like, just quit smoking in your life, you will live. That's what the woman was saying. And then one I really want to bring out because, Chris, this is going to be interesting to you, and maybe some of the others of you as well, but psychological, neurological, immunology put together into PNI. Psychoneuroimmunology is the term. Those 3 areas seem to be key to what's going on with what we call that synergistic approach, the clustering of effects. And there is not much research on this, but what we did find as a result of doing this systematic review is that we better start moving that direction, because it really does have to do with the 3 areas all pulled together. What you think about psychologically affects the brain, which then sends out positive or negative cells, which then promotes either the natural killer cells working effectively or not to produce and manage cancer cells in the body. Huge area that I think needs a whole lot more research. On the second theme, taking control of life, the meeting the physical activity guidelines was huge. If they met those, they lived longer. If they didn't, they died shorter periods. Higher VO2 max and endurance, and 8 more nutritionally sound foods. All of those had better quality of life and also lived out life longer. Cognitive adjustment strategies, positive mindset, less distress, productive coping strategies. Again, quality of life, less pain, longer survival rates. And support, all 3 of these need to be in the person's parameters for giving and receiving. Again, better quality of life and higher survival rates. The clustering symptoms I've been talking about, synergistic effect, if the symptoms are together, if they start blending with comorbid effects, you're going to have negative effects. If you start bringing in positive effects, you have positive effects. So it's really important that we start looking more into that. But this helpless, hopeless depression and risk of mortality together as a synergistic effect is a real cocktail for death. Future studies, connection between the PNI and body systems with lung cancer healing, intervention strategies for nurses and family members. And the reason I have this one up here is because from the nursing perspective, many times we do not know how to work with patients from the time that they hear they have cancer, to the treatment of cancer, to the post problems with cancer. How do we work with them on changing their mindset? Key. And then continue to examine symptom clusters and minimize the number of measures to be used so that we have one set that can go across all of them so that we can really start benefiting the patient and the client. Okay, that's it for me. Any questions?